When we talk about health as we get older, or maybe for someone we're caring for, certain things keep coming up, don't they? Like persistent aches, or maybe asthma, or even skin issues.
Yeah, absolutely. And very often, corticosteroids are part of that conversation.
Right, things like prednisone.
Exactly. Prednisone is a common one. They're really, really good at calming down inflammation and, suppressing an overactive immune system.
So you see them in different forms, like pills.
Oh, yeah. Pills for things like arthritis, definitely.
Yeah.
But also inhalers for asthma, creams for skin problems, even injections, say, for joint pain.
Yeah.
They're powerful tools for doctors.
Powerful, yes, but also ones that need careful handling, especially if someone's using them for a longer period.
That's the key point. Long-term use needs careful management.
So today we've gathered some information on this. We looked at familydoctor.org for advice on how to stop these medications safely. Good resource.
And also the American College of Rheumatology and Mayo Clinic for details on, well, a pretty significant side effect, bone weakening. Right, glucocorticoid-induced osteoporosis, it's a big one.
So our mission today in this deep dive is really to provide some practical info, wouldn't you say? Especially for older adults or their caregivers.
Precisely. We want to focus on how to use these safely, how to stop them safely when the time is right, and crucially, what you need to know about that risk to bone health.
Okay, let's unpack that. Why are steroids prescribed in the first place? What makes them so, effective?
Well, fundamentally, they fight inflammation.
Yeah.
The redness, the swelling, the pain.
That heat you sometimes feel.
Exactly. And they also quiet down the immune system. That's really helpful when the body's own defenses are sort of mistakenly attacking healthy parts.
Like in autoimmune conditions?
Yes, or even things relevant for many older adults, like arthritis, where inflammation is a major player, or asthma, where they control airway inflammation. They can bring real relief.
Okay, so definite benefits.
Yeah.
But you mentioned a catch, the downside, especially with long-term oral use.
Yes, particularly the pills taken over weeks or months. There's a list of potential side effects to be aware of.
Such as?
Well, things like fluid retention you might notice, swollen ankles perhaps, higher blood pressure is possible.
Okay.
Mood changes too, sometimes issues with memory or sleep. Stomach upset can happen. Weight gain is pretty common.
That's quite a few things already.
And there's more. Effects on the eyes, like glaucoma or cataracts developing. Increased risk of high blood sugar, potentially leading to or worsening diabetes.
That's a concern for many older adults.
It really is. Also, a higher risk of infections because the immune system is suppressed. And then there's the bone-thinning osteoporosis, which we definitely need to dig into.
We will. Any others?
Some people report feeling tired, muscle weakness, noticing their skin seems thinner or bruises more easily, and maybe wounds healing a bit slower.
Wow. Okay, so that list really underscores why careful use and discussion with a doctor are so important. These aren't just like taking an aspirin.
Not at all. The benefit needs to clearly outweigh these potential risks.
Now, something interesting I saw in the sources. Our bodies actually make their own steroids naturally.
Yes. That's a really crucial piece of the puzzle. Our adrenal glands, these little glands on top of the kidneys, produced natural steroid hormones.
When do they do that?
Especially when we're under stress. Like if you get a bad infection or after surgery, these natural steroids help the body cope.
Okay, so if our body makes them, what happens if we take these medications, these synthetic corticosteroids, for a long time?
That's where the issue of dependence comes in. If you take steroid medication for weeks or months, your adrenal glands can get lazy, essentially.
Oh, I see.
Well, they sense there's plenty of steroid hormone coming from the pills, so they slow down their own production. Sometimes they might even stop making them altogether.
Ah, so the body starts relying on the medication.
Exactly. It becomes dependent on that external source.
So if your body isn't making enough of its own, what happens if someone, say, runs out of their pills or decides to just stop taking them after being on them for months?
That's a definite no-no. Stopping abruptly after long-term use can be quite dangerous, actually.
Dangerous how? Because the body isn't producing its own.
Precisely. Without the medication and with the body's own production shut down, you can go into what's called steroid withdrawal or adrenal insufficiency.
And what does steroid withdrawal feel like? Is it obvious?
It can be. People might feel really dizzy, lightheaded, just wiped out, extremely tired.
Okay.
Stomach pain is common, general body aches. It's basically the body struggling because it doesn't have the steroid levels it needs to function normally.
That sounds quite serious. So if someone feels like that while cutting back,
They need to call their doctor right away. It's really important not to ignore those symptoms.
So you absolutely cannot just stop cold turkey if you've been on them long term. What is the safe way then?
The only safe way is a gradual reduction, a taper, and this must be done under your doctor's supervision.
They set up a schedule for you.
Exactly. They'll work out a plan to slowly decrease the dose over time, maybe weeks, maybe even months, depending on how long you've been taking it, and the dosage. You have to follow that schedule very carefully.
Don't just decide to speed it up yourself.
Absolutely not. Never change the dose or stop without the doctor's explicit instructions.
Why is that slow, gradual approach so vital? What's it actually doing?
It's giving your adrenal glands a chance to wake up again.
Coaxing them back into action.
Kind of, yeah. As the dose of the medication slowly decreases, it signals to your body, okay, time to start making your own again. It needs that gentle nudge and time to ramp back up.
That makes perfect sense. Our source, familydoctor.org, had some good practical tips for people going through this. What were some key takeaways?
Some really vital points. First, again, never stop unless your doctor says so.
Got it.
Second, if you feel unwell while you're tapering down any of those withdrawal symptoms we mentioned, or anything else unusual, tell your doctor immediately. Don't just push through it.
Okay, communication is key.
Definitely. Another good suggestion, especially for people on long-term therapy, is considering a medical alert bracelet or card.
Why is that helpful?
In an emergency, if you can't communicate, healthcare workers need to know you're on steroids or have recently stopped. Your body might not handle the stress of an accident or sudden illness properly without adequate steroid levels.
That's a really smart idea, especially for older folks who might have multiple health issues.
And finally, always, always tell any new doctor, dentist, any healthcare provider you see that you are taking or have recently taken corticosteroids. It affects potential treatments and diagnoses.
Right. Good advice. Okay, let's shift gears a bit to that other major concern we flagged, the impact on bones. Glucocorticoid-induced osteoporosis sounds serious.
It is a very significant risk, and it's particularly relevant for older adults who are already at higher risk for bone loss.
And this is directly caused by the steroid medication.
Yes, specifically glucocorticoids, a class of steroids like prednisone. It's a known side effect. And it doesn't always require super high doses either. Yeah, the sources mention that even doses as low as 2.5 milligrams per day, if taken for 3 months or longer, can increase the risk.
Wow, how do they actually damage the bones? What's the mechanism?
They kind of attack bone health from two sides. They can interfere with the cells that build new bone.
Osteoblasts.
Exactly. And they can also speed up the activity of cells that break down old bone, the osteoclasts.
So less building, more breakdown. Not a good combo.
Not at all. It leads to bone loss, sometimes quite rapidly. Significant loss can happen even within the first 6 months of starting treatment.
6 months? That's fast.
It can be. And all this leads to weaker, more brittle bones, which means a much higher risk of fractures.
And fractures in older adults can be devastating.
Terribly so. A hip fracture, a spine fracture, they can cause chronic pain, loss of independence, long-term disability, and sadly, they are associated with increased mortality.
So it's crucial to monitor this. How do doctors check for it?
The standard test is a bone density scan, usually called a DXA or DDXA scan.
Is that like a regular x-ray?
It uses very low-dose x-rays, but it's specifically designed to measure the mineral content, the density of your bones, typically in the hip and spine. It's quick, painless.
Okay. Is there anyone who shouldn't have one?
Well, pregnant women generally shouldn't have DXA scans due to the radiation, even though it's low.
Right. Now, one source mentioned something interesting, that even if the DXA scan doesn't look terrible, the fracture risk is still higher for people on steroids.
Yes, that's a really critical point from the American College of Rheumatology. People on glucocorticoids can fracture at bone density levels that might not be considered high risk in someone not taking these drugs. The steroids seem to affect bone quality as well as quantity.
So the bone might be more fragile than the density number alone suggests.
That seems to be the case, yes. So doctors need to consider steroid use itself as a major risk factor, not just the DXA score.
Okay, this is worrying. What can people actually do to protect their bones if they need to be on these medications long term?
Thankfully, there are definitely proactive steps. Number one is ensuring adequate calcium and vitamin D intake.
How much are we talking?
Generally, the recommendation is at least 1,200 milligrams of calcium and 800 to 1,000 international units, or IU, of vitamin D per day.
Can you get that from diet alone?
It can be tough, especially the vitamin D. So for many people on long-term steroids, supplements are usually necessary, but definitely discuss this with your doctor.
Okay, calcium and D. What else?
Talk to your doctor about prescription medications specifically designed to prevent or treat osteoporosis, including the steroid-induced type. There are effective options available.
Like bisphosphonates, things like that.
Yes, those are common ones, but there are others too. The doctor will assess individual risk and decide what's appropriate.
Makes sense. Any lifestyle things that help?
Absolutely. First, always aim for the lowest effective dose of the steroid for the shortest possible time. That minimizes exposure.
And maybe non-oral forms, if possible.
Exactly. If an inhaler, cream, or injection can manage the condition effectively, that's often preferred as less medication gets into the bloodstream systemically compared to pills.
Good point. What about activity?
Weight-bearing exercise is key. Things like walking, dancing, stair climbing. Anything that puts gentle stress on your bones helps keep them strong.
So stay active.
Yes. Also, avoid smoking, that's bad for bones anyway, and limit alcohol consumption. Both of those increase osteoporosis risk.
And falls.
Yeah.
Preventing falls seems critical if your bones are more fragile.
Hugely important. Taking steps to fall-proof your home, checking vision, reviewing medications that might cause dizziness, all crucial preventative measures.
And getting tested early.
Yes, early screening for bone density issues, sometimes even before starting long-term steroids or soon after, allows for earlier intervention if needed.
Okay, that's a lot of really practical advice. To help people have these important conversations, what specific questions should they be asking their doctor about their steroid treatment?
Having a list of questions is a great idea. Things like, what specific type of steroid am I taking? How long do you expect me to be on it?
Good start.
Then, what's the plan for tapering off? What should I expect during the taper? What exactly should I do if I start feeling unwell, those withdrawal symptoms?
Okay.
Maybe ask, how will we know when my body is making enough of its own steroids again? Also crucial, if I have a bad reaction, should I stop immediately or call you first?
Yeah.
The answer is usually call first.
Right, don't just stop.
Definitely. Also explore options. Could we try a lower dose or maybe take it intermittently instead of daily? Are non-oral options like inhalers or creams suitable for my condition?
Really probing the necessity and the method.
Yes. And critically, based on my risk, should I be taking calcium and vitamin D supplements and how much? Should we discuss prescription bone protection medication?
Those are excellent, really concrete questions. It empowers people to be part of the decision-making.
That's the goal. Informed, shared decision-making.
So to sort of wrap up our deep dive today, what are the absolute key takeaways we want people to hold on to?
I think number one, corticosteroids are valuable, effective drugs, especially for inflammatory conditions common in older age, like arthritis and asthma.
But there's always a but.
Yes. But they carry significant risks, especially with long-term oral use. Understanding both sides is vital.
Okay. Benefit versus risk.
Number two, if you're stopping long-term oral steroids, it must be gradual, under a doctor's guidance, to avoid withdrawal and let your body recover. No cold turkey.
Gradual taper. Doctor supervision. Got it.
And number three, long-term use significantly increases the risk of osteoporosis and fractures. Be proactive about bone health.
Calcium, vitamin D.
Exercise, fall prevention, and definitely talk to your doctor about bone density testing and potentially protective medications. Don't wait for a fracture to happen.
Absolutely. So the core message really is about communication, isn't it? Talking openly with your healthcare team.
Couldn't agree more. Whether you're the patient or a caregiver, have those ongoing conversations about the treatment plan, the exit strategy for the medication if possible, and the steps to protect bone health.
It really puts the focus on partnership with your doctor.
It does.
Yeah.
And maybe it leaves us with a final thought to ponder, given how widely used these drugs are.
Yeah.
What other, maybe more subtle, long-term effects might still be emerging or not fully appreciated yet? And how much does that proactive, informed conversation with our doctors really matter in navigating not just the knowns, but the potential unknowns, too?
That's a really important point. Constant vigilance and communication seem key.